Hi, today we're at Madison No Fear Dentistry with Dr. Logan, and we're talking about sleep apnea or sleep problems and why you would want to bring that up with your dentist. A lot of people don't think to do that.
No, and there's more and more dentists now that are starting to treat sleep apnea, and we've been treating that here for a number of years. And we make an MRA appliance here for patients, and that actually helps with their sleep apnea that they may have, and it can also help with snoring.
Snoring is sometimes one of the main reasons that gets people to talking about this because it's annoying to the other people in the house. Is that one of the main symptoms or ideas that makes you think you have sleep apnea?
Yeah, I would say snoring is one of the biggies. The biggest one though is not having enough energy for the day, finding yourself tired all the time. Your quality of sleep isn't very good. See, what happens with sleep apnea is obstructive sleep apnea is we're not getting enough oxygen while we're sleeping, and the body will the brain will actually wake you up in order to insinuate breathing again. And that can happen 100 times a night. And if you imagine somebody shaking you to wake you up 100 times a night, you probably wouldn't be feeling well rested the next day.
It's incredible when you look at some of these sleep studies, I'm sure.
Right.
And you do have your patients do a sleep study.
Yes, we do. Yeah, we actually offer sleep studies here at the office, and what we do is we actually send the patient home with the study. They can go home, sleep in their own bed where they're comfortable. They can hook up all the wires that are needed for this study and bring it in the next day, and then we actually send that report into a physician to get that read.
So you get a diagnosis that you indeed do have sleep apnea. But then, tell us about this device and how that works.
Yeah. So this MRA appliance is much like an orthodontic appliance.
Okay.
And what it actually does is protrude the lower jaw forward a little bit. And everybody's different on how far that's going to be. But that'll be what that test tells us.
Sure.
And that appliance is worn at night. And what it does is it keeps that airway open for that patient.
It literally just pushes their jaw forward so
because
their airway stays open.
Exactly, because that tongue back there, having that flabby tissue back there is what obstructs that airway for those patients. It
seems so simple, but you have good results?
We have great results with them.
Really?
Yes.
So people come back in and say, oh yeah, it's worth, they can tell right away?
Big time. Yeah, it's amazing.
Wow. So how does the process work? Obviously they need to come in and chat with you first?
Yes, yep. So they would come in and they would have a consultation for the MRA, and obviously that sleep study would have to be had first once we get a diagnosis, and then they would come in and we can start the process of making that appliance, including impressions and other visits as well.
I'm sure it's life-changing for a lot of people.
It is. Yeah, it's amazing. Patients come in and a lot of them don't know they have it. Sometimes we catch it when we do a sedation on a patient because we can tell if they're apneic during those visits.
Oh, really?
Yeah, and there's been a lot of diagnosing done there. And after the sleep study, we find that, yes, they did have sleep apnea, and they get an appliance made, and it's amazing. They come back and they're like, oh my gosh, I have so much more energy.
So much more energy.
Yeah.
They just didn't know.
That's the big thing, and that totally increases quality of life.
Right, for sure. So how can someone learn more?
Yeah, they can visit us at our website, MadisonNoFearDentistry.com, or they can always give us a call here at the office, and we'd be happy to talk to them.
Awesome. Thank you.
You bet.